Hello, my name is Tom Williamson. I'm going to be doing a presentation on the musculoskeletal system, all for my first assignment for anatomy. Just to have a look at the introduction first of all. I'm going to be talking about the structure of the skeletal system, looking at all the bones, where they're located. Then I'm going to be going on to the function of the skeletal system, talking about the 6 different functions that the skeletal system does. Then looking at the muscular system, looking at the location of all the major muscles in the body, focusing on the origins and the insertions and where they attach on the body, and then finishing off with the functions of the muscles of the body. So first up, you see an image here of the skeletal system. Now the skeletal system can be broken down into the axial skeleton and the appendicular skeleton. So the axial skeleton helps with protection. So you've got the cranium here protecting the brain, the vertebral column protecting the spinal cord, as well as the thoracic cavity, which makes up the ribs, and the sternum as well, which will be protecting the heart and the lungs. You've also got the appendicular skeleton, which is anything that helps with movement, including the shoulder girdles and the pelvic girdle as well. So all the muscles, all the bones attached to that will be the humerus, the radius, the ulna, the carpals, metacarpals, phalanges, and so on. When we look at the functions of the skeletal system, one of the functions of the skeletal system is attachment. So as you look at the image here, you can see the bicep muscle is attached to the radius, and it can also be attached to the ulna as well. Now the muscles will attach to the skeleton via a tendon. So muscle to bone is what a tendon will actually attach to. And what happens here is whatever bones the muscles are attached to, when the muscles contract, it will cause the tendon to pull on that bone, and most of the time it will result in movement to move the body in a particular position. Now moving on to the structure of the muscular system and looking at the location of the muscles, we've got the anterior view here. I've also kept the skeletal system in view as well, so we can have a look to see where the muscles will attach from the origins and the insertions. So let's have a look at the pectoralis major first of all. So the pectoralis major is on the upper part of the thoracic cavity, top of the trunk. So the muscle will originate here on the sternum as well as on the clavicle. So there's no movement that will take place when the muscle contracts here. And the insertion of the pectoralis major will be just on the inside of the top of the humerus. So when the muscle contracts, it will cause horizontal flexion. Another muscle that we've got here is the quadricep muscles. You can see it's broken down into 4 different muscles. You've got the vastus medialis in here. You've got the vastus intermedius and the vastus lateralis, as well as the biceps femoris that sits in there as well. Now these 4 muscles will cause extension of the knee, as well as the rectus femoris will cause flexion at the hip as well. So the insertion of the quadricep group is going to be down on the front of the tibia, and the origin of the quadricep group is going to be up on the femur here at the top of the femur, and the rectus femoris will actually be on the hip itself to help with that flexion.